Hello and welcome to Chairside Live. I'm your host, Megan Strong. It's a great time to tune in because today, Dr. Bai is finishing up a two-part case. In this exciting finale, he is removing and replacing the patient's Biotemps temporaries, demonstrating the two-chord technique, and then it's try-on time. He tried on several different restorations and chose Bruxer Anterior as the restorative material of choice for the permanent restoration. Let's see how he completes this exciting case. Take it away, Dr. Bai.
Thank you, Megan, for the introduction, and I want to welcome everybody back for the second part of this case where I prepared teeth number 8 and 9, and I delivered Biotemps last time, and we have not taken a final impression yet, so I wanted to wait for the tissue to heal a little bit around these temporaries, and as you can see here, the patient returns, and the tissue is just about there. You know, it's been healing for several weeks, and now I want to bring the patient back, and I'm just taking a preliminary impression of the Biotemps just in case if something goes wrong while I'm taking off these Biotemps, I can have a quick patch up chair side. So I'll snap a quick impression, and then I want to make sure the patient's numb and comfortable, and I'll go ahead and remove the Biotemps. Now, the reason why I separated the Biotemps here is because I wanted to easily remove them and not have to worry about the path of insertion for the temporaries. And I can always patch them up again with the preliminary impression that I took. So I removed the Biotemps and I removed the temporary cement. And as you can see here, the tissue is very happy. We've gone through a period of healing, and now the impression making process is going to be a lot easier. So what I like to do is pack one cord first. This is usually a smaller cord. And then take a look at the soft tissue on the facial. And I want to make sure that I can hide my margins subgingivally. So if I need to at this point, this is where I will re-prep the facial and hide my margin about 0.5 millimeter subgingival. So as you can see here, actually, we have pretty good coverage around the gingival margin, and we have very nice retraction with the first cord. So the first cord is going to give me the depth for my impression material, and the second cord is going to give me a little bit of width. It's going to expand the socket and the sulcus, and I'll be able to inject impression material in order to capture that final impression. So the second impression cord is in place, and I'll give the patient about 4 to 5 minutes before going back in and removing the second cord and capturing that final impression. I also want to try in the impression tray and make sure that we have the right size. And when the patient is ready, I'll go ahead and remove the second cord and inject the light body impression material around the teeth and into the sulcus. And I'll pick everything up with heavy body impression material. So I like to use the light and heavy because it gives me a really good combination of rigidity for the tray and viscosity for the material that goes on the teeth. And it gives me a very good accuracy for my final impression. So I place my full arch impression tray for the final impression, and after several minutes, I can go ahead and remove it and take a look to make sure that I have all my margins, which I do. And now I can go ahead and remove that second cord and redeliver the Biotemps back onto the patient's teeth. This appointment is also where we need to decide what type of restoration for the lab to fabricate for the patient. So that's something that we're going to discuss with the patient. And given that tooth number 9 has a darker dentin shade, that's going to be a little bit of a challenge. And at Glidewell, we have several products to help resolve that problem. So I actually went ahead and fabricated a new temporary for the patient, chairside, in this situation, and delivered it. And now the patient goes back out with a new set of temporaries here. Okay? And obviously, removal of cement is going to be really important here to help the soft tissue heal again. And as you can see, I irritated a little bit of that soft tissue during the work. So the impression goes to the laboratory for fabrication of the final restorations. And what I requested the lab to make is several different types of restorations. The first one being obsidian to metal. And I'll go ahead and try that on the teeth and evaluate to see how we did with that type of restoration. Normally what we do in the lab for product testing purposes is that we'll do a shootout with different products, and often we'll incorporate the results into the production line in order to improve the quality of the products. So we're constantly doing testing in-house. The second set of temporaries is the Bruxer full contoured restorations, and we tried that on and again double checked the aesthetics and the contours of the crowns to make sure that we have the right shape, the right color. And the third set of restoration is the obsidian restoration. Now, these are obsidian pressed restorations. It's a lithium silicate material, and it is a ceramic where you can etch and bond to the tooth substructure for better retention. And these restorations have been extremely aesthetic when I've used them in the aesthetic zone. Now, going back to wanting to block out the stump shade, in this situation, we'll go ahead and try in the Bruxer anterior. And what I really like about this material is that it gives me enough translucency to make the teeth look very natural. And it also has enough opacity to be able to block out the underlying tooth structure. So in this clinical situation, we chose to go with the Bruxer anterior for the final restoration. And I went ahead and delivered the final crowns. And obviously, we have to, again, give the tissue a little bit of time to heal. And as you can see here, the final result with the Bruxer anterior really did the trick for us in order to block out the underlying dentin shade on tooth number 9 and also give a very natural and aesthetic look for the patient. Well, I want to thank you again for joining me on this presentation for the shootout that we did for this patient. And yet again, we have a very happy customer with natural looking anterior teeth with the use of Bruxer anterior. Back to you, Megan.
Thank you for that, Dr. Bai. Well, that about wraps it up for this episode of Chairside Live. On behalf of everyone here at Glyvo Laboratories, thank you for watching, and I'll meet you right back here next time.